Thank you, Scott, for coming on the show today. I know you had a long travel. I gave a little bit of a background on genetic disorders when it comes to Alzheimer's and Parkinson's, and even sometimes when women are pregnant and they want to kind of see if there's any kind of abnormalities associated with the child. In particular, being that our specialty is the vision, I talked a little bit about the cornea, and in particular, Avellino Corneal Dystrophy. Yes. And exactly what that is, I'd like for you to share.
Thank you for having me again. So Avellino Corneal Dystrophy is an important genetic condition. Just by the name alone, it came from the town of Avellino, Italy. And the first examples of this were going back to 1988 when a study was performed in the United States, both of a population of individuals who actually, their eyes looked similar to the picture that you see right here behind me. The opacities that formed on the eye. Now this population in the United States, as well as individuals from South America, as I said, were traced right back to the town of Avellino, Italy, where there is a large population. This was the beginning of our ability to understand that this is an inherited genetic condition. So now today we're able to perform genetic testing of individuals through the use of molecular diagnostics to be able to find out whether people have this carrier for the gene trait, and a way to diagnose them in what's called today a predictive and preventive manner. So with predictive and preventive medicine, we can now tell an individual, were they born and do they carry the probability of having a condition that could affect their livelihood. In this case, for the ophthalmic industry, we're able to tell an individual, are they at risk of having LASIK surgery, and in the effect of LASIK surgery, having an impairment and potential loss of vision. And this is what our test is about.
Thank you very much, Scott. You
Yes.
had some slides you wanted to share with us?
Thank you, and I brought these slides with me. So what I'd like to do is start with the first image, which is really a homozygote. A homozygote is an individual who, in our profession, we're not very likely to see. This is a person who, in very rare circumstances, would have blindness by the age of adolescence. And this is a condition where both of the alleles, or where a person is homozygote for the same condition. I don't mean to get too technical on us,
Sure.
but I think that it's important to understand that this is not very likely, and this person would never be considered as a candidate for LASIK procedures. The next group of pictures is very similar to the one that's behind me. If you look closely, there's a various number of densities of snowflake-like formations or opacities. These are proteins that form on the surface of the eye, on the cornea specifically. And these people, this group of individuals, are what our test was created for. So in other words, there are a lot of people who you cannot, through slit lamp examination, be able to see these formations that are shown in these images here. So only by genetic testing can we be able to examine an individual and say, are they the carrier of this condition called Avellino Corneal Dystrophy? So the last image is one that I hate to show, and it's one that I hope to never show again, because now with our genetic test, we have created a safety factor into LASIK procedure. So with our test, people here in this image actually had LASIK surgery, and you can see that after or post-LASIK, they began to form over a period of time this density of opacities causing complete blindness. So with our test today, we've made it so that these types of individuals will never lose blindness again, and we'll save them. The last slide is one that goes back to the one that Harut just showed you on the video, and this shows you specifically the 5 layers of the cornea. The area that we just highlighted in yellow is called the stroma layer. This is the 3rd layer of the cornea, and although ACD, or Avellino Corneal Dystrophy, will show itself in any one of the 5 layers, it's the area that's most likely to have these opacity formations. It's the thickest layer of the cornea, and therefore it's the area where the most dense number of these protein formations will be found. The last slide explains to you again, as Harut explained, this is a genetic condition. It's called autosomal dominant. What this means specifically, in this image, The man or the father on the left is a carrier of this genetic condition. As autosomal dominant, it means that there's a 50-50 or a 50% probability that the progeny or the children will be carriers of this genetic condition. So in this image, it shows a son and a daughter both being carriers and a son and a daughter being normal. That's our 50-50 or 1-to-1 distribution of the condition.
Thank you very much, Scott. So Scott, basically if somebody is autosomal dominant, let's say I'm a carrier, I'm autosomal dominant for Avellino dystrophy, and I have 4 children. 2 of my children will most likely be affected by this corneal disorder.
That's correct.
Thank you very much. Kareem, how you doing today?
Good, how are you?
Good. Kareem, I know day in and day out, LASIK procedures left and right. We're busy. There's no place for an appointment. How does this safety factor of testing for corneal dystrophy, Avellino corneal dystrophy in particular, help us give the patient the best probable vision in the future?
Benefits to this, being as the only one able to offer this to our patients. The positive side to this is with this testing and the simplicity of this testing, actually let me say real quick, is just a quick swab on the inner cheek of the mouth. Thank you. This is all it is. We take this and we swab the inner cheek of the mouth 10 times. And we place it back in here and we send it in for the testing to find out if there's any corneal dystrophy. And in a matter of turnaround, 24 hours or 48-hour turnaround time, we can find out and let the patient know what are the positive and negatives to this, if they're able to proceed with having the LASIK surgery or not. Generally speaking, and correct me if I'm wrong, Harut, if we find any of this happening within, we won't be able to do LASIK surgery, or we shouldn't. And I'm going to actually turn this back over, Scott over here, to address some of these issues and symptoms and why not, and if you can just answer a few of those questions.
What our test has done for the industry, for the entire LASIK industry, has created an element of safety. What you look at when you go to the ophthalmologist as a pre-consult for LASIK, there are a battery of tests that are performed on those individuals that are all related to safety. So our genetic test actually is now incorporated into slit lamp examination and a number of other tests that you would find frequently performed in the office to say, we have added one more factor of safety to the test procedure. So now we have created made LASIK procedure itself more desirable because it's a safer outcome. And I should mention that our company, Avellino Lab USA, is, I've said we're the first in the United States, but we are just launched this test. It's a new test, and you might ask, why haven't I seen this test before? This January of this year, we became what's called CLIA certified, a license that allows us as a diagnostic testing facility to perform this test for people so we can be more predictive about individuals to, again, enhance to the successful outcome of the LASIK procedure. Thank you again for having me on your show. I did mention earlier that our test has been performed on 320,000 people, primarily in Asia, with 297 people who we protected from blindness through our genetic test. So it's a very important test, and it's become the standard of care in parts of Asia to this date, and now we're very excited about introducing it to the United States.
Thank you very much, Scott. That testing will definitely be part of our examinations, the consultation time prior to LASIK surgery. Thank you for being with us on today's show. Thank you, Kareem.